So I've got a little bit of allergies right now. Okay, Delbert says I'm good. There we go. Well, again, I do want to say good evening to you all. I know we're here to talk about something serious, but I'm glad you could be with us. Because here at St. Peter's, we are committed to providing these educational opportunities because we are the body of Christ together. And the body of Christ supports one another, right? And this is what we do. We lift each other up, we share each other's burdens, and we watch over one another the best we can. And sometimes the only way to do that is through information. So we want everybody to be aware of this very serious and significant issue so that if there's anything we can do, we're ready to help you do that. So our speaker tonight is well versed in all of this information. She's got a lot to share. She'll get to that in just a moment. But for the time being, again, I want to say that even though it is a difficult topic, I'm glad you're here. I'm glad that we could be together. And I'm glad that we can lift each other up as the community of care. Right now, Pastor McDowell is going to come on down and give us a prayer to start. And then Pastor Koenigke will tell us a little bit more about our speaker.
You know, that's how we lost one of these, right? All right. Toni, thank you for being here, and thank you all as well. I know Nate kind of touched on this. You know, some of the tough subjects in our life, they really can strain relationships, especially within the family. And even Jesus dealt with this strain within his family as he was dealing with things in his life. He was going off in the ministry, and his family was saying, hey, that's not what we want you to do, right? And so how do you deal with that strain within the family? And we see that all over the place, and sometimes it's substance abuse and what that means for the family and dealing with that. And so keep in mind that even Christ had to deal with strain within the family, maybe not in this way, but he also knows all of our needs. And keep that in mind as we listen to Toni, and we'll ask the Lord to bless her message for us and our ears as well. So let us pray. Heavenly Father, we are here today to hear what you have to say through Toni here about substance abuse and family and what we can do as we listen to those in our families dealing with this, or those that we love who are dealing with situations like this. Lord, we ask that you keep our ears open so that we can hear what we need to hear, to be used as tools and to be used as tools for ourselves as well. Lord, we thank you for the time that we have today, and help us to learn as much as we can that would be beneficial to us and those that we love. Lord, lift us up here today, and especially Toni, that we may learn and grow. Also, Lord, we know that in life there we struggle, and Lord, help us through those struggles. And when we turn to you, we know that we have forgiveness, even though we've dealt with all sorts of troubles, and we have put ourselves into trouble as well. We see in you forgiveness and your righteousness, especially in your Son, Jesus Christ, who died for all of that, so that we might have forgiveness and holiness in you. Lord, continue to help us to keep this in our memory banks and also to be faithful to it as well. And we pray this in the risen Son, Jesus Christ. Amen.
All right, Pastor Koenigke. Tell us a little bit about it.
Thank you. I'm going to read this information because it's very important, and I want to get it right. Toni Lovell is a licensed clinical social worker and a licensed addiction counselor with over 22 years of experience in the fields of social work, mental health, and addiction. She specializes in the areas of trauma, anxiety, depression, addiction, chronic homelessness, and relationship issues. Toni worked for 21 years at the Rescue Mission, working with the homeless population, before transitioning to Lutheran Social Services of Indiana in August of 2019. At the Rescue Mission, she was the vice president of programs and was responsible for all the programs that were offered for men, women, and children. She currently serves as the director of clinical services for Lutheran Social Services of Indiana and oversees their Balance Works program, which is their mental health initiative and includes office-based therapy. Toni has been happily married for almost 22 years. All right. And she has two children, ages 14 and 16. who are wonderful people, I'm sure, just as I was when I was 14 or 16. And so we welcome Toni Lovell today. We're so happy to have you here. God bless you.
Thank you, Dick.
Okay, can you hear me? Is this working? No? All right, how about now? Okay, there's a delay. Okay, well, thanks for having me. It's good to be here. When I was asked to share this topic, it's near and dear to my heart. I have a brother who's he's been battling substance use disorder probably since we were in high school, off and on. Also battles mental illness, and so was very interested in this field from probably age 16 on, and so went on to study psychology and then on to social work, and here I am. So I know this topic from a family member, so an outside perspective. I don't know this topic from someone who is struggling with substance use disorder. I only know it from the family perspective, and so I tell a lot of people that I'm a recovering codependent, so very codependent, and definitely enabled my brother through the years. And so, yeah, we learn the hard way, don't we? We learn the hard way what to do and what not to do. So I'm here to share with you, just like to do a little overview of substance use, some of the dynamics of substance use. And then I'm going to spend some time at the end talking about some what to do, what not to do, how to support your loved one that is struggling with substance use. So, and then at the end we'll do question and answer. We'll save some time for that. So, make sure this is working. Okay, there we go. I'm not sure you can see all of that. Okay, and so, you know, terminology is very important when we talk about this topic. So there's a difference between, I'm sure you've heard misuse, abuse, addiction, dependence, tolerance, all of those words, right? So I'm going to share just a little bit about the difference. Drug misuse, that's basically someone that is overusing substances, right, to get to get a state of feeling high or something like that. Drug abuse, which really is kind of, people don't really use drug abuse, that terminology much anymore. This has been kind of taken out of the professional language. And so there's drug misuse and then addiction. And that's where basically the brain kind of crosses over into a dependency on the substance to get the same effect. So it's chronic, it's long-term. Most cannot recover without help once you cross over into that category, that addiction category. And so I will talk about addiction and misuse basically today. And then the dependence, and that's where, you know, your body, your brain is actually dependent on the substance of choice, whatever that is, whether it's alcohol or another drug. Withdrawal, that happens when you stop using the substance of choice, and there's a lot of areas that, and we'll go over post-acute withdrawal in a little bit, but it's really, withdrawal can be mental, it can be physical, it can be emotional to go through the withdrawal process, because it actually, the substance, it becomes almost like a mental obsession in addition to the physical dependence where your body needs the drug to have the same result. It also becomes an obsession where you're ruminating your mind and you cannot stop thinking about the next use. So withdrawal is a topic that we could spend a lot of time on today, but we don't have time. Tolerance is basically, that word is saying that you develop over time when you're using regularly, you develop the need to use more to have the same effect. A lot of people that are in that dependence category say that they spend a lot of time chasing their first high. So the very first time they got high, they want to get back to that feeling. What happens is your brain kind of gets used to the use over time and develops what they call tolerance, and they need more of the substance. Actually, they never really get to that place of the first high. They don't know that, but they never get back to that first high experience. But they do need more and more of the drug to achieve the same effect. Factors that contribute to addiction. Studies say now that genetics plays about a 40 to 60% factor into substance misuse and addiction. There's also mental illness, right? There's dual diagnosis of people that have, sometimes we don't know what came first, but sometimes maybe someone has anxiety or depression or bipolar, and then they're also using to maybe try to treat themselves from the symptoms that they're having. Sometimes it's the other way around. Sometimes the misuse causes the mental illness. And then, you know, there's always the environment, right? Nature versus nurture. There's always home environment. You know, people maybe are around drugs and alcohol, you know, during their upbringing, or maybe it just was a common place to see substances around, or you know, maybe it's a very stressful household. Lots of stress, lots of trauma. Things can get triggered through abuse, right? We see a lot of abuse and neglect in our line of work at Lutheran Social Services. It is a precursor to drug use. And so all of these factors play into substance misuse and addiction. There's no one thing that is the cause. It's all of these factors together. There are definitely risk factors to other risk factors. There are also protective factors, right, that can protect someone. So why do two people growing up in the same household, for instance, me and my brother, one becomes, in the same environment, one becomes addicted and the other doesn't? There's protective factors. There's personality factors. There's things that, like social things that come into play, support, things like that. And I'll go to the next slide because I don't know if you can see all of that. But yeah, so there's just a lot of positive social personality things that can protect someone from becoming dependent. There's also risk factors, right? And some of those I've already talked about. But if you see early aggressive behavior in someone, that could be a risk factor. If you see the lack of parental supervision, which we do see a lot of that where I work, sometimes it's not intentionally neglectful, it's just parents have to work and they don't have time, or they have many children and they don't have time to give the supervision that's needed. So that's a risk factor. Availability, there's a lot of more availability, right? All the legalization things that are happening right now, and drugs are everywhere right now. It's I'm hearing about my son's in middle school, and I'm hearing about children that are getting expelled in middle school in 6th and 7th grade for smoking marijuana in the bathroom. I'm just like, it's everywhere, right? And this is Northwest Allen. And then obviously poverty has an impact on this behavior, right? Through multiple factors that we can talk about. And then there's the protective factors, right? So personality, some have more self-control than others, right? Some have more monitoring than others, maybe more boundaries at home, maybe more parent involvement, maybe more friends, maybe more neighbors. Academic competence, that plays a role, right? If somebody feels stupid all the time at school or that they can't measure up, you know, they might use substances to escape that feeling, right? Neighborhood attachments, that, you know, that's something that we used to have a lot more of when I was growing up, and before that. Now it seems like there's a lot of detached. You don't see your neighbors or talk to your neighbors as much anymore. You don't have as much of that support. So there are a lot of factors that play into this topic, right? Okay, so the brain, I'm not going to do a lot of brain stuff today, but basically the pleasure centers, the drugs and alcohol meet that pleasure center, and basically you need more of it, right, to get the same effect, kind of something that I talked about a little bit ago. And so those pathways get used to, the pathways in your brain get used to those substances, the dopamine that's released through the use. And your brain says, I want more dopamine. So your brain kind of almost takes over, right? It's kind of hijacked. And your brain says, I have to get more, I have to get more, I have to get more. And so people don't set out to be addicted. That's not a plan. People don't have this schema that says, I need to get this and I'm going to be addicted. It just happens. It takes over your brain. It takes over. Those dopamine receptors get you know, just overstimulated, and then more and more and more is needed over time. There's some statistics. I don't know if you'd be interested in these. And they're from 19, so they're just a little bit outdated. So this is just prevalence of substance use disorder. You can see alcohol has the highest prevalence with 14.5 million. Illicit drug use disorder, 8.3. And these numbers just for people that are formally diagnosed, right? There's a lot of people that drink, that use, they never seek help, they never seek treatment, they never actually get an official diagnosis, okay? So these are actual diagnostic statistics. So you can see all of that. Marijuana, that's probably going to go up as more and more states are legalizing. You can see meth, cocaine, stimulant use disorder, heroin use disorder. That's definitely going up. I'm sure you've all heard of the opioid crisis that's been going on for the last several years. That we just see more and more of that. And actually a lot more deaths as well, overdoses, unfortunately, as the years go on. Here's just some statistics about the prevalence of substance use and mental illness together. That 3.6 million in the middle there is the overlap. I would argue that it's higher than that. Again, this is people that have been formally diagnosed. The people that I see in my program, I don't think there's one person I see that with substance use disorder that doesn't also have mental illness. So it is probably a lot higher than that 3.6 million. They go hand in hand. This is just, again, a CDC 2020, a little outdated statistic. 13% of Americans reported starting or increasing substance use as a way to handle the stress and emotions of what's going on with COVID. And we've seen a huge increase in anxiety, especially with our young people since COVID. And I don't know when it's going to stop. I don't know if when we're going to see that relieve, but a lot more people are using, a lot more people have reported higher prevalence of drinking and overusing substances since the pandemic started, and we're seeing that in our kiddos too. A little bit about stages of change. So this is a way, so looking at motivational interviewing, it's called motivational interviewing. It's a way to help kind of assess where the readiness of someone who is struggling in this area. And so we use this to assess whether someone's ready for change, right? Because if someone is not ready to change, they're not going to change. If someone is in denial about their misuse or their addiction, it's going to be really hard to intervene and going to treatment. Let's say we send someone to treatment or we do an intervention and they're still in denial that there's even a problem. It's not going to do it's not going to be very helpful. So this model helps us determine where people are at. And there are things you can do to encourage and influence this, right? If someone is in the pre-contemplative stage, and it starts at pre-contemplative and it goes around. They might be thinking of it, but they're not ready yet. And so it really depends on where someone's at before we know, before the treatment's going to be effective. And we really need to be paying attention to that if we have a loved one. And there's things that you can hear and listen for. And so the pre-contemplation, here's just an example. I don't have a problem, so I call that denial. When someone says they don't have a problem yet. They've lost 5 jobs and they have 3 DUIs and they've been arrested, but it's not that big of a deal. People might minimize in this stage. They might really minimize their behavior and act like it's nothing. Or they might turn it on you and say, well, you always worry. You worry about everything, and you're making a big deal of it. Okay, so those are some things you might hear if someone is in this stage. Contemplation, I know I have a problem. I probably should do something, and maybe that's in the future. I hear this a lot on the phone line that I man. Someone called me actually on New Year's Eve, and they said, I just want to get through New Year's Eve, and then I'll get help, right? Just one last time. So this is someone who knows they need help, but they're not quite ready, but they know that they will get help in the future. Preparation. So I'm going to stop using weed on Monday, but I really don't think it's that bad. So this is saying I'm going to take a step, but kind of in the back of their mind, it's not that bad, and I might not stop forever, right? This might not last. And so in this stage, someone might be preparing as well for, getting things in order if they're thinking about going to treatment, if they're thinking about stopping. They always talk about, even for smoking cessation, planning out a quit date and really just making preparations. And what am I going to do instead, right? Because sometimes when someone stops a physical habit, they need to replace it with something else. And so that could be going on in this preparation stage as well. And then action. That's what we want to see, right? Everything's gone. Throwing everything away. I'm cutting off ties with friends. I'm ready. Okay, so this is where you start to see actual action and change. Things can still go back the other way, but this is progress, right? And then maintenance. I've been clean and sober for several months, attending meetings, calling my sponsor, right? This is what we would call, maybe working in a recovery program, right? Working the 12 steps, going to Celebrate Recovery, going to AA, NA. This is someone that's really just trying to maintain their recovery, their sobriety. And those two are very different, by the way, recovery and sobriety. Sobriety is just abstinence, not using. Recovery is actually working on, what are the things that caused me to use in the first place? What are things that I can do every day to prevent myself from using again? Those are two very different things. And then termination. I don't know that it ever terminates, but this is a stage where I'm done, I've been clean for years, I'm maybe ready to sponsor other people. If they have a plan, if they have cravings, they have, they're gonna stay connected in their program, help help others possibly, which is actually a really good thing to keep you grounded when you're giving back and helping others. And so, yeah, the maintenance stage. Principles of effective treatment. So there's principles, right, for drug treatment. These are things that you might be looking for, like how do I know what to do, where to go, things like that. I'm going to leave, I think you might even have, you have some handouts today that you can have that will direct your path of whatever you're dealing with. And so resources are key. Complex, very complex disease. It is a disease. It's not a moral failure. So that is very, very important that you take away today, that addiction is not a moral failure. It is a disease of the brain. It's treatable, is the good thing. It definitely affects the brain and changes in the brain. A lot of those changes, once again you get into the dependence stage, are permanent changes that happen, but it is treatable with a good program, with good support, with good services, with a good recovery program. It's very treatable. No single treatment is appropriate for everyone. There's a lot of different options for people in treatment. Some work for others and some don't. And sometimes there's multiple attempts that are, most of the time, multiple attempts need to be made. Because every time someone uses and maybe maintains for a while, or they get into recovery for a while, and let's say they have a lapse and they use again, they're going to learn from that lapse. It's really important that you don't shame people that lapse, because they're going to learn from it. Every time they do it, they're going to learn from it. And that's how we learn, because we have thick heads. We're very stubborn people, and we have to learn the hard way. Treatment needs to be readily available. Luckily, Fort Wayne has some really, really good treatment options. So we're still a little lacking for people that use Medicaid as their insurance provider. Still a little lacking for adolescents. But for adults, we have great options here in Fort Wayne. Effective treatment attends multiple needs of the individual. So good treatment is going to be very holistic. It's going to look at mind, body, and spirit, right? They all go together. They all function together. If one is broken, the others are in need of healing. And so a good program is going to have a very holistic approach. And they're going to look at multiple things that they can do, anywhere from therapy to yoga to, there's biofeedback now that people are doing in treatment programs that it's really helping the brain heal. There's just a lot of approaches: group therapy, individual therapy. Remaining in treatment for an adequate period of time. It takes your brain a long time to heal from addiction, right? And so, unfortunately, insurance companies, they used to pay for 30 days or more. Now it's very limited of what they pay for. So this can be very difficult to keep someone in treatment for the time that they actually need to heal. And then follow up as well after that. There's a lot of behavioral therapies, individual, family, group. Family is really important. I stress the importance of family therapy for someone who is in treatment, because it's a family disease. It affects everyone in the family. I can attest to that. It's not just the person that's suffering from the addiction, and they are suffering, but it's also the people in the family that suffer, and they oftentimes don't know what to do. They oftentimes don't know what the answer is, or how to respond, or how not to respond. And so family therapy can be really, really effective with someone in treatment. Medications are an option. There's a lot of different medication regimens out there. There's a lot of different beliefs about their effectiveness, or whether someone should take medication to assist them with their recovery or not. But there are options. There are some really good options that help during that withdrawal, that initial withdrawal phase. And then there's some longer term options as well that people can use. Individuals in treatment, they must plan to continually access services. They must plan for things that change and needs that can come up, and in the meantime while they're in treatment, things change. They just need to have support, and they need to have access to services and treatment. Many drug-addicted individuals have other mental disorders. I already covered that, and you saw some of those statistics, and those need to be treated as well. There's a lot of controversy about what should be treated first, and everything that I've been learning and researching says the best is to treat them both at the same time. They used to believe, no, you had to treat the mental illness first, or no, you have to treat the substance use first. And right now the research is saying treat them together. Why not? It's all part of the same, and that's part of holistic care. Medically assisted detoxification is only the first stage of addiction treatment. So if someone is detoxing, have you heard that term before? They're detoxing. All that means is a physical release from the body. That does not mean spiritual, emotional treatment, healing, recovery. All that means is they're getting the drug out of their system. And some detoxes are much harder than others. Opioid use disorder detox is probably the worst as far as symptoms. And in fact, that's a lot of the reasons why people keep using. They can't stop because they don't want to go through that horrible, horrible withdrawal. Alcohol can be really, really bad as well. I mean, people can even have seizures withdrawing from alcohol. Those probably the top two. So if you hear someone's detoxing, that does not mean that they've gone through a recovery program or that they're stable even. That just is the very beginning stage. Treatment does not need to be voluntary to be effective. So I worked with drug court a lot in my days at the rescue mission. Court ordered, court mandated, it can help. It absolutely, people, maybe when they first start, they're not willing, but sometimes there's a switch, a light clicks on, and they're ready to go. And so it does not mean that it's not going to be effective if they're mandated. Sometimes they need that extra structure. I know my brother did. My brother didn't change until he found himself in a jail cell. So whatever it takes. And sometimes the mandated is not a bad thing. Drug use during treatment must be monitored continuously, or lapses during treatment do occur. So really, really important. Structure, accountability, those are really important, especially at the beginning. It's really easy to lapse when there's no structure, no accountability. We all need accountability, right? And someone with a use disorder, they're going to need more accountability because there's a lot of temptation. There's a lot of triggers that happen, and they don't even know that they're triggers, right? And so the very early stages, people don't even know what triggers them sometimes. It could be a smell, it could be a sound, it could be someone yelling at them, it could be a song. Music it was very triggering for my brother. It could be relationships, sex. Those things can really trigger someone to use again. And so when someone is coming out of treatment, they really need that structure. We found a lot of successes in inpatient or halfway houses or programs that actually have a lot of monitoring during those early days. Treatment programs should test clients for the presence of HIV, hepatitis B, C. We saw a lot of that at the rescue mission. When people are in the midst of their use, they have a lot of risky behaviors, right? And so they're exposed to a lot of things. And again, part of holistic care is mind, body, spirit. The body has to be treated. A lot of medical issues we see are uncovered in the recovery process. Teeth haven't been cleaned for years, cavity, all of those things. So a good program is going to assess for everything. They're going to look at everything, right? I mean, I see back injuries constantly being a trigger for someone. The pain, people don't like pain. Does anyone like pain? Someone who's recovering from substances and, they want to take a pain medicine, which could throw them right back into, their use again. So we have to be really careful with just physical conditions when someone is in recovery. This might be hard to see. So this just kind of outlines the different things that should be addressed when someone is in a recovery program. There's going to be, childcare issues, right? For women especially. I worked with a lot of women over the years in substance use, and one of their biggest barriers was how can they go to treatment, how can they get help when they're a single mom, and they have no one to watch their children, right? So looking for programs that might provide childcare is an option. Vocational services, work. How do people, maybe in substance use for years, maybe their work history is, just shattered and they don't have a good resume and they might need help getting back on their feet vocationally. Mental health services, of course, is part of it. Medical services, education, HIV/AIDS, legal services. A lot of our clients are struggling and they're just overwhelmed with all of the things that come after they get into a program, and then life starts hitting them and reality starts hitting them and all of these things that they've neglected. And there could be, warrants, there could be legal fees, there could be child support that they haven't been able to pay. So there's a lot of legal support that's needed for someone in recovery. Financial services, helping someone with the budget, helping someone get back on their feet. Housing, big one, right? Where do they go? Let's say they're coming from jail. Where do they go? How do they get back on their feet? And then family services, right? So we talked about that importance of family support when someone is recovering. What does that look like in your family? It's different for every family. So those are some of the dynamics. How does stigma affect people with substance use disorder? There is still a lot of stigma, unfortunately, about substance use disorder. There is, it really does stop people from getting help when they feel hopeless, or when they feel like people around them are not understanding them or supporting them. It can really keep them sick. It keep them in the cycle of addiction and abuse. When there's stigma, they might, families might hide it. Families might lie for each other to cover it up because there's so much stigma. There might be shame. And we'll talk a little bit about language too, and using the right language with people so we don't create shame. So yeah, all of these things, a healthcare provider even might discriminate with someone with substance use disorder. Hopefully we've grown over the last few years that there's not as much of that. Just the negative perception of someone with a substance use disorder. Hopefully we're getting better with what that looks like, and anybody and everyone can be affected by substance use disorder, right? It doesn't discriminate. It doesn't have to be a certain race or a certain socioeconomic status. It doesn't have, it doesn't have to do with any of that. Of course, there's factors that poverty is one of them that can influence, right? But addiction, it does not discriminate. It goes across every line that we have. So how can we change stigma? When talking to people with substance use disorder, loved ones, colleagues, using non-stigmatizing language. So I have a handout that I brought today that you can take with you that will help a little bit with that, and things that can kind of keep that stigma going. Use person-first language and let individuals choose how they are described. Person-first language maintains the integrity of individuals as whole human beings by removing language that equates people to their condition. This is one of the things that really bothers me about some 12-step meetings. That you have to introduce yourself. I went to several with my brother, and hi, I'm Jamie, I'm an addict. Don't like that. No, you're a child of God who has substance use disorder, right? That's not my identity, right? And so not identifying someone by the substance they're using can help with stigma. When you use the language, oh, he's just an addict. I mean, what? Can you imagine what that would do to someone's sense of worth? Like to describe someone by the thing that they're using. And so those are things we can do to stop the cycle and to stop stigmatizing and shaming people that have this disease. This is the handout that you should have, and this just kind of goes over some of the language. I'm not going to read all of it to you, but instead of addict, person with substance use disorder, probably the most important there at the top. Person with opioid use disorder, right? Instead of, getting rid of the word drunk, alcoholic, junkie, all of those things that people used to use to describe someone with this condition, or even former addict or reformed addict. That's still defining someone by their behavior instead of who they are. So hopefully this handout helps you a little bit with language, so we can all do our part to stop the stigma of this disorder by just simply changing our language and how we refer to people. They're children of God. They're human beings that have a disease. I mean, you don't call someone who has cancer, oh, that cancer guy over there, or that that person, that diabetic over there, or we don't do that with physical ailments, right? And this is a physical. It's a physical, emotional, and a mental ailment, right? And we just don't label people that way, nor should we. How else can you help besides the stigma? Not, using correct terminology is very helpful. Connecting people to resources, promoting support groups, meeting the client where they are, right? And that's part of that assessing where they are in that stages of change, right? They might not be ready for help. Educate yourself. Don't be afraid to ask. How can you help someone with relapse prevention when they come out of recovery, when they come out of treatment? How can you help them? Responding appropriately to a relapse or a lapse. This is really, really important that we don't shame people when they mess up. Gosh, if I got shamed for every time I made a mistake, I probably wouldn't be standing here. Why is it so easy to shame people that when they're making that choice to use again? Again, it's not a moral failure. It's a disease, and it will happen. There will be lapses. There will be relapses. That's how people learn. That's how we all learn. We've all learned from falling, making mistakes, saying things that we shouldn't have said. We've all learned from our sin, and so don't shame someone who lapses or relapses. Figure out how you can help them. Educating yourself on triggers. There are a lot of different triggers, and everybody's triggered by different things. I mentioned that earlier. But if someone, let's say, in my field is trauma, I work with trauma a lot, so I know there's a lot of triggers with trauma, and they can be subtle and they can be big things. And sometimes people don't even know that they're being triggered, right? Someone might just have a reaction to something, or sudden sound, or the way somebody says something, or their voice, or maybe someone's talking down to them, and that's a trigger because they were really abused as a child. So there are a lot of things that can trigger people. Understanding that with your loved one can be really effective. Complacency. I see this a lot too. People think they got it licked. They think they got it. They don't have to do anything anymore. They got this, and they stop working their program, or they stop being invested. They stop trying. So that's something you can look for. Being anger, overwhelmed, or frustrated. Those are really big triggers, right? Sometimes if you're overwhelmed, you can't even put one foot in front of the other. Sometimes the next thing that's going to happen is there's going to be a lapse, because that's what they do know. That's what's more comfortable sometimes. So knowing these things are really helpful. Chaotic, just chaos in general can be a big trigger. Use of defense mechanisms, right? We talked a little bit about one of the defense mechanisms is minimizing, right? It's not that bad, or blaming. I see that a lot too. If you see someone blaming everyone else for their use, that can be a big trigger, a big sign. So again, the risk factors that we talked about earlier, genetics plays a pretty big role. Gender can play also a role in prevalence of substance use. Although, it's starting to kind of catch up, men and women together. We're seeing a lot more women as well using substances and even opioids. Race can be a risk factor, especially in areas that there's been a lot of discrimination, racism, things like that. That can be a huge trigger, risk factor. And then psychological, we talked a little bit earlier about personality. There's personality differences, a feeler versus a thinker, for instance. A lot of the substance users I've worked with have, they're feelers. They take things to heart. They might be a little more sensitive to criticism or something like that, and they might take things more personally. Can be really hurtful. And then, contextual. That could be anything. That could be environment, what they've seen, where they're living, the stress of their environment as well. I talked a little bit earlier, post-acute withdrawal syndrome. This is something that you should know about and you should look for, and what the symptoms are if someone is withdrawing from substances. You're going to see a lot of these things. You're going to see a lot of irritability and a lot of hostility, and those are things that, as a family member, you can just try to practice patience with. Depression, very common. Anxiety, mood swings, and again, you're stopping that dopamine from coming into your brain, right? Your brain gets used to that level, which is a neurotransmitter. Gets ready. It's had this level for who knows how long, maybe years, and all of a sudden you just stop. You just take it away, right? You just take that dopamine out. You're gonna have some mood swings. You're gonna be grumpy. You're gonna be irritable. You might even lash out about, with people around you. Very common. Low energy and fatigue as well. Sleep disruption. Insomnia is very, very common with someone who is withdrawing. Limited ability to focus. Can't think clearly. Lack of libido is a common thing. And then chronic pain. We see a lot of chronic pain. All of a sudden, they're not medicating that pain anymore, and all of a sudden everything hurts, and they didn't realize it. They've been ignoring those things for years sometimes. So very, very helpful to know those things. So your role, reinforce and praise a person's confidence in his or her ability to remain sober. So shame doesn't work. Encouragement works, letting someone know that you believe in them, because you want them to have confidence in themselves as well. Celebrate every accomplishment, right? Every day that they are sober or clean is a celebration. Every day. Celebrate that with them. Encourage patience. Be patient with people. Takes, maybe they've been battling this for years and years and years and years. It's not gonna turn around overnight. There has to be patience. Support groups. I can't say that enough. To have someone, with support groups, they do a lot of things. They kind of help people feel like they're not alone, right? They also encourage accountability, especially when there's a sponsor, someone that is, working with you individually to, for accountability. And, you call them every day. You check in with them every day. You're getting frustrated, or if you're thinking, I can't do this anymore, a sponsor can really help keep you on the right path and keep you focused, right? Take self-reported symptoms seriously. Someone has symptoms, or they're telling you they don't feel good. Take it seriously. Most likely they're not just attention seeking. Help plan for emergencies, so be proactive, and there's things that can happen. There's overdoses. There's a lot of different situations that could come up. You want to help your loved one prepare for these things, right? What if their car breaks down and they're in their old neighborhood where they used to get drugs? Help them prepare for things that happen. No community resources, and I did bring those today that will help. Give feedback. The HALT, right? Hungry, angry, lonely, tired. If you notice your loved one is hungry, angry, lonely, tired, those are things that can trigger them to use again. So those are things, we help each other when we see those things. I see that you're really angry today. What can I do to support that? Big warning sign that they're gonna lapse, right? I see that they're lonely. Maybe they've cut off all of the so-called friends that they used to have, and they're very lonely, and they don't have anyone that they feel like they can talk to. Help. Help listen to them. Help connect them to a group or someone. Exercise, can't say that enough. Diet and exercise, big things. And again, looking at holistically, if someone is not, is eating Twinkies every day for dinner, they're not going to feel good, and they're not going to feel like, they're not going to expel the energy that it takes to continue with their recovery. What not to do. Don't look down on people that have this disease, right? It's not a moral failure. Avoid blaming and shaming, and avoid comparing them to other people or to siblings. That's really harmful for the sibling too. I know that by experience. Don't ignore the problem. Don't make excuses for people. Don't ignore the problem. Don't force them to quit. They have to be ready. We talked about that on the stages of change. They have to be ready. Don't enable them. Enabling versus helping. Sometimes it can be really hard. When do you help? When do you enable? I always used to say it when I worked at the rescue mission, when someone would ask, how do I know the difference? I'm like, well, if you're enabling, you're doing something for someone that can do something for themselves. So when you're trying to help, I know it sounds, sometimes you try really hard to help someone, and you just think, okay, I'm just going to pay their rent for this month, or I'm just going to go take them to the gas station and fill up their gas tank. That can cross the line. That can be enabling, right? Because why would they change if everyone around them is just going to pick up the pieces and do everything for them? What would encourage them to change? And then number 5, the most important for me, is don't give up on people. Maybe they've been in and out of treatment centers 5, 6, 7, 8 times. Don't give up. There's still hope. That's the last thing they need, is for you to give up on them, because then they're going to give up on themselves, right? Okay, so educate yourself. We talked about that. I've brought some resources, and I am getting short on time. Addressing the issue, not ignoring it, very important. You really need to confront it. You really need to speak in love to someone about it. Researching treatments. There's a lot of different options here in Fort Wayne. There's a lot of different options online, other states. And boundaries, this is really important. We gotta set boundaries with people. We have to, if you set a boundary, you stick to it. I'm not gonna pay your rent anymore. You don't hear a story and feel sorry for someone and say, okay, one more time, I'll pay your rent. If you say you're not gonna do it, don't do it. Again, if you don't set those boundaries, you're not teaching someone to become accountable, right? They're not gonna get help if you keep enabling them to do what they're doing. So you can set boundaries in love. You don't have to be mean about it. You can just say, that's not gonna work for me. That's not gonna work for me. I use that line a lot. That's not gonna work for me. I can't do that. I love you, but that's not gonna work for me. So setting boundaries is really important. And then self-care. Yay, self-care, really important. You stressed out with a loved one that is suffering, self-care for yourself. Exercise, therapy, support yourself. There's a lot of support groups. There's Mom of an Addict. There's one at Fort Wayne Recovery that meets 2 Sundays a month that helps families that are dealing with this issue. And man, can that be helpful to have someone around. So there's some different ways to support someone, support groups, therapy, treatment centers, case management programs. Having a case manager working side by side with someone can really help. Peer recovery coaches can help. That's usually someone who's trained but is also has dealt with or is dealing with substance use disorder themselves. There's also helplines, and I did bring some information about the Family Support Services Helpline. That is a collaboration with the city, the Fort Wayne Police Department and Lutheran Social Services, where we can answer your specific personal questions about family. We can get you resources, we can get you support. And so I have brochures on the table that you can take, and if you have a specific situation, you can call this helpline, and I will call you back. Don't have much time for questions, I'm sorry, I rambled on, but does anyone have any specific questions? I can also stay after if you have questions, or you can call me on the helpline.
We've got about 5 minutes for questions, so if anybody has one, I'm sure Toni would be happy to answer it. I'll give you the mic, and you can ask your question now. Who'd like to go first? Okay. Thank you.
Toni, thank you for your presentation here, and I think there's a lot to kind of decipher here of things that we deal with, the people that we've dealt with, and even struggles that we might have on our own. One of the things that was kind of caught my ear was the language. It's okay. But is language, right? How best do I go about whenever a situation is presented to me that I can kind of get away from the things that I've heard? You know, you were talking about, don't talk about being an addict, right? How can I prepare myself to make sure that those things don't kind of slip out? And that I'm approaching the situation, as you said, treating them as though they are a child of God.
Yeah, I think you have to check your heart first, right? Because what lives in our heart comes out through our mouth often. So check your heart, check your beliefs. Sometimes, you know, we have these, we jump to judgment when we have no right to judge, when we've not been there. So I think that helps. I mean, it definitely helped with my education and compassion over the years to not be judgmental. And then you don't have to worry about it slipping, because your heart is lined up with God's heart for these people, right? For us, for all of us. We all need forgiveness. We all need grace. We all need second chances and third chances and fourth chances. So check your heart first. And then the other thing I would say is just repetition and practice, right? It doesn't, if you're changing, you know, I know there's a lot of language shifts over the last several years of things that, you know, are not politically correct anymore. It's hard to stop saying something that you've said for years and years and years. And so practice saying it. Repeat it in your mind over and over again. You know, substance use disorder, substance use disorder, substance use disorder. That's what I've had to do over the years. When I started in this field, it wasn't substance use disorder, right? So we all have to kind of practice those things and keep our hearts in alignment with Him and how He sees people, how He sees us. So.
Okay, it looks like we've got another question.
Quick. That's the first time I have heard you're a child of God. That is a great approach. In the beginning, to say it brings us all together. We're all a child of God.
Yes,
This can be
amen.
any of us. So that's an awesome statement.
Thank you.
That makes it, kind of keeps it simple.
Yeah,
In the beginning, start
Yeah.
right off with that. I love
yeah.
it.
Yeah, do you guys introduce yourselves by your sin? I don't. I'm Toni, I'm a reckless driver who speeded on the way over here today.
Okay, anybody else? Questions, comments? Okay, we got one up at the front.
Kind of off topic. With so many chronic illnesses, insurances cover them through their life. Like if you have emphysema, substance abuse disorder is a chronic illness. Do you ever see insurances changing or the medical community changing to do an ongoing treatment that they'll cover? I know that's
It's
where
hard.
it seems like the roadblocks always are, is
Yeah,
because
it's hard.
we
Well-
don't, the insurance will only cover, you got 30
Yeah.
days, or you don't get any. So they get
Yeah.
lost in the shuffle.
It's
Is
very
that
hard, and
something that-
most of the insurance work I do is on the therapy side, and it's amazing. Medicaid is actually better for covering therapy than private insurance, because private insurance you have to meet deductibles, and you have to pay full price until you do, and then people can't afford $9,100 a week for therapy, so it's really hard. So, yeah, sometimes people that are on Medicaid actually have sometimes a better benefit. Not for treatment, not for inpatient. Medicaid's not a lot of places will provide that. We have a couple in Fort Wayne, but so therapies, that's where I see most of the insurance gaps and issues with being able to kind of cover. And yeah, people are already struggling financially oftentimes after they come out of treatment. They've got bills and and it just exactly, and it's very overwhelming. So.
All right, I think we have time for one more question.
Okay, the question I have, I know Alcohol Anonymous and all that, they want you to admit that you have a problem, and I understood what you said in that. Do you ever feel that they need to admit it before you do it? Because they will lie to you.
Yeah, I mean, there's a part of admitting it and there's a part of defining yourself by it, right? They're very different. So I admit that I have this struggle. Yes, it's very important for the realization, but to define yourself by that struggle, that's where I have a problem.
But they do need to admit that they have a problem.
Absolutely. Yes, that's part of the stages of change, right? If they live in denial, they're never going to get help. Yeah, they have to see it, and the problem has to, it has to be to the level that it forces them to get help, right? So the discomfort has to, of using has to be higher than the discomfort of going to get help. That's why the enablers like me can, just postpone the inevitable. If I just keep enabling, they're never going to be uncomfortable enough to get help, right? Because I'm going to make the way. My parents and I, we did this and we did that and we bailed out and we did this and it was never that uncomfortable, right? I mean, it might have been embarrassing for a while, but it was never that uncomfortable until we said, nope, we're not doing this anymore. We can't. And then they feel, they don't have another option. So it's either, death, jail, prison. Those are the options. So.
Well, that is true. Well, we want to say thank you for coming and helping us, and we're so glad that you'll be around afterward to actually answer some more questions if people need it. So let's give Toni a round of applause.
Thank you. Thank you. Thanks for having me.
And I'd like to make just a quick statement and then invite you all to dinner. So here at St. Peter's, we talk about being part of the body of Christ. And I will say this. Every one of you is here for a different reason tonight, whatever that reason may be. So you may be struggling. You may know someone who is struggling. You may have family members who are struggling. And as Toni mentioned, whenever we talk about addiction, we talk about it in terms of mind, body, and spirit. Sometimes the tendency is to think of the church as, something to bypass in favor of professionals. But think about it this way. We are professionals of the Spirit. And so if there's anything we can do for you or your family members, I encourage you to come talk to us. We're always available and always open for that. Because you don't have to do this alone. You shouldn't have to do it alone. And we don't want you to do it alone. So let us be your partner in this. And let us help you if we can. Because the fact is that we do care. And moreover, your Father in heaven cares. So let us do what we can. With that being said, I would like to invite you downstairs. We do have our dinner. There's plenty of food, and you're all welcome, whether you signed up for it or not. Come on down. We're having rotisserie chicken. Ooh, right? Good stuff. So please join us. And if you'd like to talk to me, Pastor McDowell, Pastor Koenigke, or Toni, don't feel afraid to do so. All right. Peace be with you, and thank you for coming. We're going downstairs to the Cornerstone room. Just follow the smell of the food.